Hi, I'm Charlie Sauer, president of the Market Institute Foundation and editor of U.S. Policy. Today we're talking about healthcare price transparency. And our guest, well, he had a few choice words about the current state of the market.
The price gougers destroyed hit and run indulgences. Here's a big fat check. Nefarious. It's an assault downstream of a flawed premise. Completely illegitimate, soiled. That is criminal. What is wrong with healthcare? The government.
The Mercatus Center recently published a paper on price transparency in the age of COVID, and we thought this was an interesting paper. So we reached out to one of our good friends, Dr. Keith Smith of the Surgery Center of Oklahoma. He's a co-founder of that surgery center. He's a co-founder of the Free Market Medical Association, and he's one of the first people to post his prices online. We started off this conversation by asking him about his transparent prices.
The prices that we have on our website are all inclusive, what Jay Kempton calls cash out the door pricing. So a patient pays and they know that there's no bill forthcoming after the procedure. And that for me, for I think everybody that is involved in this movement in an honest way, that's what transparent pricing is. If you have a price that has an asterisk by it that says, these three things are not included, then that gives a lot of wiggle room to someone who has every intention of price gouging you after the fact.
What Keith is doing at his practice is revolutionary, and it's something that politicians and academics have tried to figure out for a long time. How do you make healthcare prices transparent? What Keith did is he just thought of himself as an entrepreneur and went out and posted his prices. And what we would think would happen in a market happened. Surgery centers from across the country started posting their prices. Even hospitals and ERs have started posting their prices as well. This is price transparency in the making. Now, that actually brings me to the first problem that we have with Dr. O'Shea's paper, and that's that it at least seems to accept government-mandated price transparency as a solution. And that is something that both Keith and I agree will not work for the market. In fact, it codifies the high prices. And it even says the cash price is the highest price that somebody can pay. In fact, if you look at cash prices, they're often the lower price that somebody can pay. And that's because if you're billing insurance or billing the government, there's more paperwork involved. So we can't look at a government one-size-fits-all mandated price transparency. Now, we do have a few more issues with the paper, and I want to move to one of those next, and that's reference-based pricing. I think in this case, Dr. O'Shea just wanted to mention all of the possible ways to move to a healthcare price transparency market, but this is something that Keith and I have both talked about a lot, and that's what I wanted to ask him about next.
Well, understand that reference-based pricing is discussion downstream of a flawed premise, and that is that Medicare pricing is legitimate at all. Real prices emerge from a competitive marketplace. They're never imposed. So I've argued all along that Medicare pricing is completely illegitimate. And people say, yeah, but that's the benchmark we have. Well, it's still illegitimate. So discussing a price that's 150 or 180% of Medicare, everybody just needs to know that is downstream of a very flawed premise of prices that are imposed, not prices that have emerged from a competitive marketplace like in other industries. So once again, I think we have to be very careful with our terms and having conversations downstream of a completely soiled and flawed premise.
While we didn't fully agree with the paper, there are two solutions that Dr. O'Shea mentions that makes this paper worth talking about, and that's health savings accounts and patient rewards. So a health savings account is what allows patients to have money in their pockets and increases their incentive to shop for healthcare. And patient rewards are something that I haven't seen in a lot of public policy writing, if at all. Patient rewards actually incentivize patients to go to a doctor like Keith Smith where the patient can save money and the business can save money. And that is a great deal. I then asked Keith Smith about his experience with patient reward programs.
I know Adam Russo at the FIA group, if one of his female employees has a maternity claim and they go to a hospital with this very high quality with whom they worked out a reasonable arrangement, the health plan will buy diapers for a year, and they'll buy baby food for a year, and he's got incentive programs like that that are operational that work beautifully. So, once again, the private sector comes up with solutions like this that are very helpful. They're not coercive. They're not mandatory. They preserve choice. And the government just doesn't know how to do that. The government wants to mandate everything and then thump you if you don't comply.
There is a lot of innovation currently in healthcare and in healthcare price transparency. We are on the cusp of major changes, and that's why we don't think that we need the government involved. If anything, we need to get the government out of healthcare, and that will create more price transparency. And that's where I wanted to leave off the conversation with Dr. Smith. I wanted to get his thoughts on the current state of the healthcare price transparency movement.
I think there's either a market for honest pricing or there's not. I believe there is, and my facility is a manifestation of the desire for a true marketplace, and I hope it grows. And I'm here to tell you, we will help our competitors come on board. But to mandate it means really there's not a market for it, and I think it's sort of a backhand slap to this growing free market that we need government to help out with a mandate. That would indicate there's not a market for it, and I would argue otherwise.
Thank you for watching our video. Please hit that subscribe button. Every subscriber helps. Slap that like button while you're at it and leave a comment down below telling us what video you want to see next. Thank you.